In individuals with either hip pain, back pain, maybe even knee pain, like patellofemoral pain, we'll often find weakness in the hip, okay, in the glutes and in the small rotators of the hip and in the gluteus medius. So we have a couple common exercises that we'll use frequently, so I'm going to show you a few of those. One is the side-lying clamshell. And what I'll do is I like to use the wall to give you some feedback because we don't want you to roll backwards as you do this. So what we'll do is we'll start with both cheeks against the wall, bottom and top one, your feet against the wall, and your upper back against the wall. From this position, tighten up the abdominals a little bit, draw the belly button in, keeping the feet together, roll the upper leg out or up. Slowly return, trying not to roll backwards or forwards. Come up slowly, pause at the top, slowly lower back down. And you should feel this kind of in the outer hip here. An easy thing to make this harder is to add a rubber band or an ankle weight on the top leg. So you can put the rubber band around the knees and then do the exact same thing, rolling up, pause, and back down. And a simple thing to do from here is then maintain the same position, straighten the top leg, keeping the hip, the calf and or foot and your shoulders against the wall, both cheeks still, and then slide the leg up the wall. Typically you won't be able to go as high with this particular movement. We want to avoid rolling the knee down as we come down, keeping it pointed straight ahead the entire time. And then up. Just keeping contact with the wall the entire time. And if you had a rubber band doing that clamshell, what you could do is place your band above the knee, feet against the wall with cheeks. So you have the band here doing your clamshell, nice and controlled. And then from here, just like you did before, straighten the top leg. So now the band is trying to pull you forwards, adding a little resistance to the glutes. And then we're using the glute medius to slide the leg up the wall. Maintain contact. So this makes it harder. So make sure you master the first one without the band. Get good control over that. Make sure you're not crunching at the hip, at the trunk here. Just keeping everything stable and lifting the leg.